vous avez des micros sur les tables qui sont au premier rang, donc n'hésitez pas à venir peut-être c'est toi de poser des questions, c'est quand même toujours mieux de discuter, d'être au premier rang. Qu'est-ce qu'on prend? On a décidé de parler en français ou en anglais?
Moi, je peux faire les deux, mais...
What do you prefer? You speak English?
Or Chinese. Or Chinese.
Chinese is welcome, but it's up to you. Maybe we cannot understand everything, but we will try. Okay, so welcome to this press meeting about the International Hospital Federation, which will gather key drivers of national and international policy of the healthcare sector in next November in Taipei. And for this topic, we have the pleasure to welcome Dr. Eric de Rodenbeck, Chief Executive Officer to International Hospital Federation, and Dr. Nina Kao, who is consultant at the International Cooperation Department at the Taiwan Hospital Association, so specialist about healthcare and health system. You know, in Switzerland we have also a hot debate about this topic. So we have the pleasure to hear you. Before to give you the floor, I would like to ask you to sign our golden book. Yeah, and I will give you a little souvenir. That's the publication of the press club. We had our 20th anniversary last week, and we published this little book magazine there. And so I have the pleasure to give you the floor, Mr. Rodenbeck, please.
Okay, thank you and good morning everyone. So first I would like to thank you for hosting us for this press conference and to thank also the Taiwanese delegation for supporting this press conference. We are not that many, so let's make it as informal as possible, but I wanted to take the opportunity of this press conference to give you some background information about the IHF, because even though we have been existing for a long time, the organization was created in 1929, the IHF doesn't have such an important media press. We are a membership organization, that means we have been created bottom-up by members, and we first serve our members. But I think this press conference is an opportunity for us to reach out to a larger audience. And so that's why I would want to start briefly to tell you a little bit about the International Hospital Federation. So as a membership organization, we are the only organization worldwide that is representing the national organization that in their respective countries are the one representing the healthcare service delivery industry. For example, in Switzerland, you have an association, an umbrella organization called H+. You have in France the French Hospital Federation, in Taiwan the Taiwanese Hospital Association, and so on. So all these, we are a non-governmental, non-political organization, of course, and therefore we welcome any national organization regardless of any political matter, as long as they fulfill the goal of supporting the delivery of healthcare to the population according to the, I would say, usual principles that you expect in delivering healthcare. That means to deliver high quality, safe care to the whole population without any discrimination. So as an umbrella organization that was created first by a Congress in 1929 in the USA, we have been evolving, and we have adopted Switzerland as a host after World War II, and you can understand why, that during a period the members were not always friendly, between 40 and 45. So after 45 we re-engineered, if I can say, or relaunched the organization in Switzerland. And interestingly enough, when I look the minutes of this first meeting we had in 47 back in Switzerland, in the WHO was participating to our reconstitution as an association in Switzerland. And that means that we have had, since the beginning of WHO, so very strong ties with the World Health Organization. And we have been historically the organization they call upon when they want to discuss technical matters in relation to the role of hospitals and in relation to service delivery. So this is one of our key missions. We of course collaborate with other international organizations. We voice the role of the healthcare service delivery, especially with the OECD, that is based in Paris, for which we participate also to their technical groups. They are working currently on the hospital performance. And we have the usual activities that a membership organization has, and that is listed outside of the room, a journal that we have a copy, webinars, platforms, and all that kind of things, because the idea of an organization like ours is to help our members to share their knowledge so that they don't reinvent the wheel, and of course to bring forward topics of discussion, and that's what I'm going to bring forward in the second part of our talk that we usually bring in our conference. So we have now an annual conference, and it's very specific in the sense that as a membership organization, it's hosted by our members. So last year it was hosted by South Africa, who is a member of IHF, as through the Ministry of Health, because we have also some ministry that are a member when most of the healthcare service delivery is public and under the auspice of the ministry. And this coming November, we have the pleasure to be in Taipei, hosted by the Taiwan Hospital Association. And it's the first time that we are hosted as the World Hospital Congress in Taipei, for which we have had this association as a member for a long time, back in the 50s. Perhaps you want to say a few words on the background of the Taiwan Hospital Association, your mission, and why you're hosting the Congress. Switch off.
Yeah, yes, exactly.
Thank you very much. Good morning, ladies and gentlemen. This is Nina from Taiwan Hospital Association. I'm the consultant of the Taiwan Hospital Association International Cooperation Department. So thank you, the chairperson, to host this press congress. It's my great pleasure that I have this opportunity to come over here to join this press congress, and I also would like to use this opportunity to introduce the Taiwan Hospital Association. Taiwan Hospital Association was founded in 1968. Yeah. But you know that in 1970, Taiwan Hospital Association already joined the IHF. So you can see that the Taiwan Hospital Association has a very long-term relationship with IHF. So every year that we have very interesting, and we are very exciting. If IHF have any program of the Congress, we are very willing to supporting, and we're very willing to join this bigger Congress. And the Taiwan Hospital Association, this is now so far the member more than 2,000. Including the medical center, regional hospital, community hospital, and so on. And this is also just like a bridge between the hospital and with the government. So the association just make a law to debate or to negotiate with the government, particularly for some of the very important medical system initiative or reform. Try to make the most benefit from between the governments, hospitals, and patients. Particularly for the the Taiwan, we have very good health insurance system. However, the aging people is increasing, the new technology and the new drugs. So then so far the national insurance system has to be reformed. So Taiwan Hospital Association play a very important role to negotiate with the government to how to make the new system can be more benefit for the patients and for the hospitals. And also the Taiwan Hospital Association, we also to do many of the just like workshop conference to try to build up the hospital's capacities, including for this year we are very happy and we have this opportunity to host the Taiwan, the International Hospital Federation World Congress. So actually in Taiwan, each of the hospital's leaders, they are very, very exciting and very supposedly including the funding, human resources, technology. For all of us, we try to our best to host this Congress, to make this Congress to the best. And besides the professional side, I think Taiwan is also a very, very nice place to, for all of the foreigners to visit Taiwan, to try to taste very delicious food in Taiwan, the cultures, the very beautiful things in Taiwan. So anyway, we will try our best, and I welcome all of our guests, even from Geneva, from other countries, can visit Taiwan. Thank you.
Thank you very much. And yeah, definitely, this is a great place to be. I've visited it twice already. Perhaps I just wanted now to give you some highlights of what usually you can find in an IHF Congress and what specifically will happen in Taipei, because from a professional perspective, I think that can be of interest. So more or less, everything is streamlined around three major aspects. One, we want to make sure that our members can share their knowledge and can leapfrog from each other. So when you talk about health systems, very often, you know, people say, yes, but in my country it's very specific. And it is true that in each of the countries you have specificities in the way the system is organized. This is related to the overall organization of the country, to the history, to the geography, to factors like that. But when you come to the core drivers that we are facing in the various countries, whether you are the most advanced or the so-called less advanced countries, we are finding more and more communalities and more the need to understand how we can face these challenges. And that's one of the important features of this conference, which is a conference that is member-driven. You know, it's not a commercial conference where people are trying to get people that are speaking on the topics that are the ones that are the most frequently discussed currently, you know, the flavor of the month. It's the members are organizing themselves the sessions in which they bring in the most specialized people to speak on topics that are of the major importance for them. And I will just highlight a few of them that's going to be touch-based, which are topics I think that in wherever you are coming will probably resonate. One of the big topics that we are discussing and trying to share approaches on the role and how hospitals need to change is of course the one of the combination of the aging population and the increase of the multi-chronic conditions. Yeah, on that we have a little divide with the approach on WHO that has been mostly on the so-called non-communicable disease from historical reasons. We have taken a route that is more the one that the OECD has taken, considering that the major challenge health systems are facing today is that the population has not one specific non-communicable disease, but have a combination of them. And the system is not well organized to deal with this combination. It's well organized to deal with specific organs, specific disease, and that's how most of the hospitals are organized in the wards today. And therefore, this reorganization, along with the aging population, which brings also a lot of social issues, is a major importance for the role of hospitals, including the fact that the hospitals are moving much more to outpatient activity to support home, the inpatient at home, if I can say, and all these different elements, and all the issue of the end-of-life care also. So all this is very much discussed, and people are comparing experiences. The other important topic, and that's part of who are our stakeholders, because as we represent the healthcare organizations, the people speaking of the healthcare organization are the executive teams, the leaders. So we always have the topic of management and leadership, which is quite important, of course, for us. And on that, the IHF has been able to put together a platform with all the major professional associations of healthcare executives. And we have adopted in a congress, in Chicago Congress in 2015, what we call a core competency directory. That means we have agreed at the global level on which are the core competencies that should be by anyone who wants to manage a healthcare organization wherever in the world. So we are moving on that. We have developed a platform that is available for anyone in several languages, including Chinese, English, Spanish, French, and hopefully we can, and Portuguese. So, and so we are going to see how we can further implement that, how we can push forward the education in a way, because our goal is really to push up as a, if I can call it, political goal of IHF, of what we call the professionalization of healthcare management, for which is still an important lack. Perhaps not so much in the advanced country, but definitely in the emerging world and the less advanced countries. Other topics that is always a key one, for which we have collaborations with other international organizations with whom we work closely, like the International Association of Patient Organization or the International Society of Quality Insurance, is talking about the role of the patient engagement. And that's also very important from an institutional perspective. And also talking, of course, on all the issues related to the patient safety and quality. So all these topics are quite critical around the world. And the fact that you have countries that are presenting how they are advancing on that is a great opportunity to, in a one-stop shopping, if I can say, have an overview of the advances and how these challenges are addressed. And of course, as this is the topic of this specific topic of the hospital, which is around smarter hospitals, patient-friendly and smarter hospitals, all the issue on how the technology can serve the goals, because very often you have conferences where people are presenting what the technology can do. Our approach is a little different. We consider that the technology has always to serve the goal of the organizations and not the way around. And of course, so it is around how we can better leverage the various technologies, especially all the issue of putting the electronic health records, the use of big data, I mean, all these things that we often discuss. So that's a big part of the element. The other things is we take the opportunity of gathering to get the leaders from around the countries to have them to share what are key elements they are facing in their countries. And this year we will be talking about the issue that you have certainly read in the press with what happened with the NHS, the cybersecurity. This is a growing problem in the healthcare organizations, for which, unfortunately, most of the healthcare organizations haven't taken the steps the overall industry have taken to protect, because they didn't think that, you know, people could attack them to try to get ransom on the blocking the medical records or blocking their system, which is happening more and more, perhaps not so much in the media, but it's happening more and more, especially in the US. We have seen what happened in the NHS and in other parts of the world. So we want to see how we can create here also some kind of a response altogether around this major issue. And the last thing I want to highlight is that we have a General Assembly out of which we are going to adopt a certain number of resolutions, and we are going to cover 3 important topics for which our members are going to work over the coming year. One topic is the one of violence. This one is a topic for which we have been involved for a number of years with the initiative led by the International Committee of the Red Cross called Healthcare in Danger, in which they have asked the IHF to share one subgroup on trying to increase the protection of the facilities in situation of crisis. But we want to go further, because more and more countries have to face, we can say, low noise violence, in the hospitals, which is putting at risk the mission, the core mission of the hospitals. So we want here again to see what our members are doing, to better disseminate the mitigation measures they put in place, and also to bring forward, probably more in the media, that a hospital can serve its mission if it's a safe haven for the people who are working there and for the people who are treated there. So for us, this is going to be a big one that we really will want to push strongly during the coming year, and the IHF Taipei conference will be a moment where we'll be pushing this topic. Two other topics will be brought forward. One is also related to a report that might not have been so high in the media, but is an important report for the professional, which was released early this year with the OECD Ministerial Press Conference on the waste in the health sector. There is a lot of waste that can be reduced in the health sector. So we think that as healthcare provider, our credibility is at stake if we don't take this very seriously. And some have been doing a lot of work to reduce the waste. Waste in useless exam, waste in the way we are using the resources, and waste also in the way resulting from the way we are organized. So that's also an important issue, and for which we probably will continue to work closely along with the OECD. And the last one, which is a more technical issue, is the measurement of outcome, which is a critical issue when you consider that healthcare is costing a lot of money, and how much money you are ready to bring in, especially from the public sector, to support healthcare to the population. You need to be able to show that what you are doing is providing results. So healthcare has been mostly financed around the fact that we are doing activities. You finance because you are taking care of a person, because you are doing exam, but not so much around the outcomes that we are producing by doing the care. So that's also something for which there is a big movement with a number of international organizations, and for which we want to make sure to be fully on board. So this is what you see. It's going to be a very active 3 days in Taipei. So, but I hope that people will have also some time to visit around. Perhaps on your side, some highlights of how this is also going to be an opportunity to see some very specific development in Taiwan, which are very interesting, even though they are not so known, because Taiwan is not so visible internationally as some other countries, while for the systems, for the population, they are doing very interesting things.
Thank you, Eric. I think Eric has already to describe the whole of the conference, the main thing, and the keynote, or the power panels. So totally, actually, we have 5 stations of keynote station and 36 of the power panel. So for each of the power panel, actually, we invite different countries to share their experience in healthcare, including the quality and the IT, how to use the IT technology into the healthcare system. In Taiwan, we have 2.3 million of the population. The national health insurance coverage over 99.6%. So that's almost each of the people. When you're born, you get the national insurance card, and you can go to the hospital very easily. So the hospital, the clinic, it's very convenient in Taiwan. You don't need to waiting for a long time. Then you can use the insurance card to access any of the healthcare you needed, and you just pay a little amount. So even our coverage about 99.6%, but actually the expense of the healthcare only 6.6% of the GDP. Yeah, so this is quite incredible, and the system of course, that we would like to share how Taiwan is successful in the national insurance, the system. Of course, because as I mentioned, the aging people, the new drugs, the new technologies coming. So our national insurance system is going to the next stage. So we call the second stage of the national insurance. The government, they have some policy. They would like to encourage the people and the hospitals to do more of the prevention. Because if you can find your disease in early stage, the cost will be going down. So the government give many of the subsidies to the hospital to encourage the hospital to do more of the prevention program, to encourage people to go to the hospital to do the early screening. I think this is also another very significant in Taiwan. And the other one is, because as I mentioned, in Taiwan, very easy to access to the hospital. So the patient, sometimes they have like the shopping behavior. So they go to A hospital, and they go to B hospital, they go to C hospital in the same day. So maybe they will get the same medicine from 3 hospitals. They will make something, the medicine will go into Western. So the government now, they create a cloud system, we call the medicine cloud system. So when a patient visits one hospital, then they visit another hospital in the same day, the medicine will be show up when the second of the doctor. So the doctor cannot prescribe the same medicine. So this is another system. So all of the hospitals in Taiwan now will use this system to reduce the waste. I think that is quite important because all the health insurance, the biggest amount expense is the medicine. So if we can reduce the medicine cost, then we can increase the quality of the health care, for the patients, even for the facilities. And so this is the experience we would like to use this opportunity to share how we run this program. And besides, I think besides the session we can share this of the policy in Taiwan, we also invite more than 40 the IT company, but they do the health with the medicine. We call the smart healthcare. The company, they have developed many of innovative devices or the equipment or the system. So they were going to have exhibition. So they have their booths. They will show how to use those of the device or the system to care of the patient. And we also arrange the hospital after the Congress. So the participants can choose which of hospital you would like to visit. So the hospital we choose there are 4 hospitals. They all run very, very good a smart healthcare system in their hospital. They use different devices to care the patient, to increase their patient safety, to increase the hospital management's efficiency. So the guests from the other countries visit Taiwan not only to join the conference for the professional, the dimension, you can get many of the information from Taiwan, from other countries. You can share each other, you can interact with each other. You also can visit the hospital, and you will know how the hospital use those of the innovative technology to care the patients in Taiwan. So I think that in UN Sustainable Development Goal 3 is important. They say achieve well-being in all ages. So in the Sustainable Goal 3, the Goal 3.8, they say how to reach the universal health coverage is the most key to reach the Sustainable Development Goals. So how to make the universal health coverage, I think is quite important issue, not in Taiwan, but for the other countries. So Taiwan would like to share this model for the other countries. If any countries, their health system would like to get reformed, we are very, very happy to share this system with all of us. Thank you.
Thank you very much for this presentation. I think it was a very interesting topic because as I am also involved a little bit in the local politics with my colleague, we are also interested to to know more about how to manage the healthcare system and the topics you will discuss in Taipei are quite interesting from this point of view. Okay, so I open the floor to questions. I don't know if there are some questions from the audience. Not now. Oh, okay. Please. Okay, monsieur, and after you can speak in the microphone. You have to push the button.
Yes, I have a question for Nina Cao. So you will share about the health insurance system during the Congress with other countries. Do you expect out of the Congress some commitment, some project to work on with other countries, or is it just one opportunity to share and then we go back to our own countries, or yes, do you expect more cooperation? Yes.
I think for each of country, they have their own health policy, and they also have their challenge. They also have the strengths. Yeah. So I don't think that any other country can copy this system to their country. Then they can run this one, right? But actually, this is just like an experience. You can learn from this experience, then you can modify your system, then you can apply to your country. So actually, as I know, many of the countries, their health manager, they visit Taiwan. Particularly, they will say they would like to visit the health insurance bureau. They will know how the system runs and how to build up the system. So from this of the interaction, they will get some of the ideas. Then when they go back to their country, they will know the country's strengths. They can modify the system. Then we can work to interaction with them. And if they have any question, we are willing to help. Yeah.
Thank you. Okay. Yes, please. Yes, push the button. Yes.
Sorry, I'm Zheng Wei Ko from Taiwan. I have a question for Dr. Rodenbeck. I'm really happy to see this conference is going to be held in Taiwan. I'm really happy to see that result and outcomes. And I'm very confident that the result and outcome of this Congress will be one of the great contributors to WHO's Health for All goals. So I have two questions, very simple one. So among all the healthcare related international conferences, what do you think IHF Congress in Taiwan this year, is different from its kind? And the second question is, what kind of outcome do you expect we will have from this Congress from a regional level and also the global level? And thank you so much for your answer. Thank you.
Okay, they are simple questions, not necessarily simple answers. So the first one, yeah, you are right. There are many conferences all around the world, a lot of them are commercial. I think if we look the fact that we are not what we call a commercial conference, but a membership conference, the whole dynamic and the interaction is very different. We are really a community, and we welcome, of course, all the members and participants out of this community, but there is really a sense of community. It's very interesting because now, when you are talking about the new economy, we talked about the models of sharing around the new economy with Airbnb and so on as a big development. That's what we have been doing in associations for many years. And so therefore, we are really on the forefront of the new economy in the association if we know how to leverage that well. So a conference like this one can allow to leverage that well. And to somehow come back on the previous question, yes, among members, there is a lot of support that is put in place. So it's beyond just, I'm going to a place, I'm going to sit and listen to people. It's also I'm going to take back home and I'm going to bring up and put together interaction and relation. and solve my problem, because it's very practically oriented, because leaders of healthcare organizations, you know, they are people that have to deal with their operations and have to deliver services. The other thing around the outcome, I would say this year is a very specific year for the conference in the sense that next year, this will be the 40th anniversary of Alma-Ata. So there will be a big round around the primary healthcare and the importance of primary healthcare. When Alma-Ata happened, there has been a big mistake. They have kind of opposed primary healthcare and referral care. And after Alma-Ata, there has been a number of meetings to show the role of hospitals in support to primary care. So the big message that we want really to convene around the issues that I've put forward is that now we are clearly in a system approach. We need definitely a very good and strong primary care, but at the same time we need to have an effective referral care, and we more and more will be in network system, and the fact that the players may be not the same as in the past.
Could you explain more what is the primary care and the referral for non-specialists?
Yeah, you are very right. So primary care is, well, it's two things, I would say. It's at the same time organization and processes. In terms of organization, when we think about primary care, we think about the first level of care that is provided to the population by non-specialized or not so specialized providers, but can fulfill a lot of the basic needs of the population in the health, and especially have an important role in public health and the prevention, but also in the basic curative care at the level of the household, the individuals. But also along with primary care, you have the idea of a system that is more and more complex, because in advanced countries now we are talking about teams that are working with the community, taking on board the community aspect of the population, more a role on the prevention, so that you know, things are in place with all the different places, the schools, all the workplace and so on, so that the impact of the risk factors are lowered and people get less sick, but also when people are sick, they find an immediate response that is really adequate to their needs. And a lot of it can be treated without not so much complexity. In lower income countries, it's community health workers. In advanced countries, more the general practitioners that are doing this first line of care. So the idea was that there's been too much resources that has been on the technology, on the hospital, and not enough on this front line, which has a high impact in terms of potential cost and coverage and interaction with the population. But when we see is that when the secondary care doesn't work, the primary care also cannot be fully at its full potential. And when the primary care is at its full potential, it needs also the support of the secondary care. The other thing that is happening is that with the growing urbanization, the players that are doing the frontline care and those who are doing the referral care are more and more intricated. That's when it's the same word, French and English. It's more difficult for French speakers. Intricated, and you see, because the purpose is really to figure out how you can put the people at the center and have all the players that are fulfilling the support of the person, including with social care, rather having the person to go to the various services and having services that are delivering at different point without discussing together. So there is a big issue that are discussed. We are working closely with WHO on their framework that was adopted in the last World Health Assembly on what is called integrated and patient-centered care, to make sure that, you know, this link between the primary or frontline care and referral care is totally streamless.
Okay.
Long explanation for a
Yeah.
short questions, but I think it's very critical in the health sector.
Okay. Thanks. Other questions? Yes, please. Come. We are the front rows to speak in the microphone.
Hello, I'm another Taiwanese here. My name is Evelyn, and I also care a lot about the health issues. And I wish to pose a question for Nina. So, would you share with us the working relations between the Taiwan Hospital Association with the IHF? And what do you think is the significance of our association being a part of IHF? Thank you.
Thank you. As I mentioned, that Taiwan Hospitals Association is the full member of the IHF on 1970. Yeah. So since then, I think that the Taiwan Hospitals Association has a good relationship with IHF. And for Taiwan, I think that we are because IHF is a very specific association that is under WHO. Then Taiwan, you see that very difficult, yeah, in the international status, particularly for every year when we would like to join the WHA, then always we have very hard time. Yeah, the government actually in Taiwan, we are very willing and we are very hope that we can to share the Taiwan's the public health or the health our achievement or even our the outcomes for the global society. However, yeah, usually that we don't have this very good opportunity to can share in the global society. So certainly Taiwan, certainly IHF, I think it's a very good opportunity for Taiwan that we can present Taiwan's healthcare system, yeah, for the global. Because I think that Taiwan has to be seen if the UN Sustainable Development Goal, they say leaving no one behind. So Taiwan cannot be forgotten. Thank you.
Thank you. Thank you. Maybe another question, last question is you have, you spoke about the new threats. So you explained the highlights of the topics you will discuss, but could you be more precise about what you call new threats in healthcare system and hospital for hospital?
Yeah. So, so the one I mentioned was about the problem of the security, which is a major threat in the...
But you mean bombings or...
No. It's the... No. Well, if you are a hospital in Afghanistan, bombing might not be a problem. And it's an actual, more than a threat, it has been a reality. No, it is about the fact that we rely more and more on the IT infrastructures.
Okay.
And that IT infrastructure is several things. It's first the privacy of the people. So imagine if people can get access to the records and to the privacy, that's a problem. But also more and more, we have seen it, I think in the media a day or two ago, that a company of pacemaker has security limitations and people could potentially reprogram the pacemakers from outside. Imagine that within the hospitals, everything is under these IT systems, the labs, all the interactions between the activities, the monitoring, and so on. So the fact that we can be threatened with especially what's called the threat on the objects, IT of the objects, where you can take control, has to be very seriously taken, especially when you see that there is with the currently evolution in regard to healthcare, and that's the ICRC project, is that those who are threatening potentially don't have a moral barrier saying, you know, this is healthcare, we won't touch it, because, you know, it can be our mother, it can be our children, whoever we are, and therefore we should not touch it. So it's very important to also, that's why the other aspect on the violence, to reinstall the fact that, and it's very important in the advanced country, that there should be no tolerance on any type of violence in the health sector. Because imagine if in Geneva, which is, you know, highly democratic, safe place, people can have misbehavior, can have violence, can threaten health personnel, and think that they can do it and getting away. Imagine what happens in a country where you don't have this environment, in a country that goes into a situation of unrest and war. You know, and that's what happened, for example, in Thailand a few years ago, when there has been this, which was not a country under conflict, but had a social movement. They blocked the hospitals because of the social movement without taking care of the fact that doing that, they put the life of people at risk. And that's not acceptable. Whatever the cause you are fighting for, which might be a good cause, which we don't want to get into this discussion, the hospital should not be the hostage of that. So this is a very important issue that we, the professionals in the healthcare organization, have to raise the voice on that and have to put forward a little more louder.
Okay, thanks. So thanks. Don't know if there are other questions or comments or remarks.
Perhaps
yes,
one
please.
comment I would want to build up on Taiwan among the accomplishment, and it's very much linked with the role of hospitals. We see the hospitals are curative places. Hospitals have a very important role in the health promotion also. And there is a network of health promoting hospitals in which the Taiwanese have taken the leadership, a world-recognized leadership. So in the role of hospitals as a promoter of health, we have a lot to learn from Taiwan, because they have done a lot of very interesting experiences, mobilizing the community, taking any opportunity to make sure that, you know, whenever you step in a healthcare facility for any reason, we take care of you as a patient because of your disease or your health problem, but we also take the opportunity of this encounter to try to put you on track for better behavior for your health, because with the aging population and multi-chronic, this is critical. So here, this is also a key issue on which having the conference in Taiwan, which is a leading country on that, which is not always known out of the specialized circle, I think is a very critical element.
Okay. Thank you. So thank you very much. If there is no comment or so, I would like to thank you, to wish you full success for this important meeting in November. So thank you.
Thank you very much, and thank you again also for
the
to be
support
coming and the support
of Taiwanese ambassador who is there. Yeah. Thanks.
Thank you. So, and if you had one-to-one questions, even in French, I'll be happy to respond to them. Thank you so much. And if you want to have a coffee or something outside, it's for you. Thank you so much.
Good.
Thank you.